Imagine waking up in the morning, feeling fine, but the moment you stand up, everything spins. Your legs feel weak, and before you know it, you stumble. This might sound like something that could only happen to someone younger or healthier, but for millions of older adults, it's a terrifying reality they face daily. And what's even more alarming is that something as simple as taking your daily medications could be silently putting you at risk. If you or someone you love has ever experienced dizziness or loss of balance after taking medication, you're not alone. In fact, it's a more common problem than you might think, especially for those over 60. What's more, up to 40% of fall-related hospitalizations in older adults are linked to medications that interfere with balance and coordination. Whether it's a blood pressure pill, a sleep aid, or even an antidepressant, many of the drugs we rely on to improve our health might actually be contributing to dangerous falls. In this article, we're going to take you through some of the most common medications that could be causing your dizziness and loss of balance. And more importantly, we'll show you what you can do to stay steady and safe. Stay with us to the end. It might just save you from a life-threatening fall. 1. Sleep aids. The hidden danger lurking in your medicine cabinet. It's a familiar situation. The night is quiet, but sleep seems so elusive. You've tried everything, perhaps a warm cup of tea, reading a book, or even a gentle stroll around the house, but nothing helps. As the hours pass, you reach for the little pill that promises rest. Sleep aids like Ambien, Lunesta, or even the over-the-counter option, Benadryl. At first, they seem like a quick fix, helping you fall asleep when nothing else works. But these medications come with an unexpected side effect, one that can leave you feeling off balance the next morning. You wake up after what you thought was a full night's sleep, only to find yourself groggy, dizzy, and disoriented. The mental fog doesn't clear up after your morning coffee. Instead, it lingers, affecting your ability to think clearly and move confidently. This grogginess, which often includes a sense of imbalance, can make simple activities like walking to the bathroom or moving around the house dangerous. When you're still feeling the sedative effects of a medication, your body becomes less coordinated and more prone to falls. For older adults, this effect is even more concerning. A nighttime trip to the bathroom, a task many of us do without thinking, can become a perilous journey if you're still under the influence of a sleep aid. The risk of falling increases, and a fall at an older age can result in serious injury, long recovery times, or even life-threatening consequences. Fortunately, there are safer alternatives to using sleep aids. One of the most effective methods is practicing good sleep hygiene. By establishing a consistent bedtime, creating a relaxing pre-sleep routine, and reducing screen time before bed, you can improve your chances of falling asleep naturally without relying on medications. These small but impactful changes can help you achieve better sleep while minimizing the risks. If sleep aids are still necessary, it's crucial to talk to your doctor about finding safer options. There may be alternatives that are less likely to cause grogginess or affect your balance. And when you do get up in the middle of the night, take extra caution, stand up slowly, and allow your body time to adjust to avoid sudden dizziness. Safety should always come first. 2. Blood pressure medications, a lifesaver with side effects. High blood pressure is often referred to as the silent killer, affecting millions of people, especially those over the age of 60. It's a condition that often goes unnoticed until serious complications arise, which is why managing it is so important. Medications like beta blockers, for example, metoprolol, diuretics such as hydrochlorothiazide, and ACE inhibitors like lisinopril are commonly prescribed to help control blood pressure. These medications can be lifesavers, but they come with side effects that may cause problems for some people, particularly older adults. One of the most common side effects of blood pressure medications is dizziness. These medications work by either affecting the heart's ability to pump blood or by influencing the body's fluid balance, both of which can cause your blood pressure to drop when you stand up quickly. The result? You may feel lightheaded, weak, or unstable. This sudden drop in blood pressure, known as orthostatic hypotension, can be especially dangerous for older adults. A simple change in position, like getting out of bed or standing up from a chair, can lead to a fall. For many older adults, this dizziness and loss of balance is a real concern. What might seem like a minor side effect for younger people can become a significant hazard for older individuals who are already at greater risk of falls. The good news is that there are ways to reduce the risks associated with these medications. First, it's important to stand up slowly. Take your time when getting out of bed or standing after sitting for a while. Allow your body to adjust gradually to the change in position. Staying hydrated can also help, as dehydration can worsen the effects of blood pressure medications. Drinking enough water throughout the day ensures that your body has the fluids it needs to maintain a stable blood pressure. Another crucial step is to monitor your blood pressure regularly. Keeping track of your numbers will help you understand how your medications are affecting you. If you notice frequent dizziness or weakness, or if you experience falls, it's vital to speak with your doctor. They may need to adjust your medication, change your dosage, or explore other treatment options to help manage your blood pressure safely. It's also worth noting that you should never make changes to your medication regimen without consulting your healthcare provider, even if you feel the side effects are manageable. It's essential to work closely with your doctor to find the best possible solution for your health. By staying proactive and attentive, you can manage your blood pressure effectively while minimizing the risks of dizziness and falls. 3. Antidepressants. Helping your mental health, but at what cost? For many older adults struggling with depression or anxiety, antidepressants have become a vital part of their daily lives. These medications, especially selective serotonin reuptake inhibitors (SSRIs), serotonin norepinephrine reuptake inhibitors (SNRIs), and tricyclic antidepressants can bring a sense of relief, helping people cope with their emotions and regain a sense of balance. But what many might not realize is that these medications, while beneficial for mental health, can sometimes come with unexpected and troubling side effects. As we age, our bodies respond differently to medication. For older adults, antidepressants can sometimes trigger dizziness, heart issues, or even fainting spells. This can be especially concerning, as it may cause you to lose your balance, which can lead to falls or other accidents. Medications that target serotonin levels, known for regulating mood, can also affect blood vessels, sometimes leading to arrhythmias or irregular heartbeats. This can leave you feeling lightheaded, weak, and vulnerable. In addition, as we grow older, the risk of falls becomes more pronounced. It's crucial to understand that these medications may interfere with your ability to maintain balance or react quickly, increasing the likelihood of falls or injury. So, what should you do if you're on antidepressants and start noticing balance issues or dizziness? First and foremost, don't stop taking your medication without talking to your doctor. Mental health is just as important as physical health, and it's essential not to compromise your mental well-being. However, there are alternatives and adjustments that can be made to minimize risks. Your doctor may be able to adjust your dosage, suggest different medications with fewer side effects, or recommend other forms of therapy that work in tandem with your current medication. Remember, you don't have to face these challenges alone. It's important to communicate with your healthcare provider and discuss the possible adjustments that could help manage both your mental health and physical safety. 4. Diabetes medications. The dangers of low blood sugar. Living with diabetes can be a daily challenge, especially as we get older. Many older adults rely on diabetes medications like insulin or sulfonylureas, such as glyburide, to help manage blood sugar levels. These medications are essential in keeping glucose levels stable, but they can also cause a dangerous drop in blood sugar, leading to a condition known as hypoglycemia. For those dealing with diabetes, this can be a serious issue, especially if blood sugar levels fall too quickly or too low. Hypoglycemia can cause a variety of unsettling symptoms, such as dizziness, weakness, confusion, and even fainting. These symptoms can impair your ability to think clearly and react properly to situations, increasing your risk of falls or accidents. It's no surprise that hypoglycemia is one of the leading causes of emergency room visits related to diabetes, accounting for around 25% of such visits. For older adults, this can be especially risky, as the effects of low blood sugar can sometimes be mistaken for something else, like dizziness from dehydration or fatigue. So, what can you do to avoid these dangerous episodes? The first step is to regularly monitor your blood sugar levels, ensuring they don't dip too low. It's also crucial to be aware of the early warning signs of hypoglycemia, shakiness, confusion, and sweating, and take action immediately. Always carry a snack, preferably something with quick sugar, to help raise your blood sugar if you start feeling any symptoms. If you experience dizziness, weakness, or confusion, it's important to talk to your doctor. Your medication regimen might need an adjustment, whether that's a change in dosage or a switch to a different medication that poses less risk for hypoglycemia. Living with diabetes doesn't have to mean constantly battling low blood sugar. By staying informed and vigilant, you can manage your condition and maintain your health and well-being. And again, always consult your doctor about any changes in your symptoms. Working together, you can find the best solution to keep your blood sugar levels stable and your risk of falls minimized. 5. Pain medications, the hidden risk behind relief. For many older adults, chronic pain can be a constant companion, whether it's from arthritis, back problems, or other age-related conditions. To manage this pain, doctors often prescribe painkillers like opioids, e.g., oxycodone, hydrocodone. These medications can offer significant relief, but there's a hidden risk that many don't fully understand. They can make you feel unsteady and less coordinated. Opioids work by slowing down brain function to block pain signals, but they also affect your ability to react quickly. This can make everyday activities, like walking across a room or getting out of a chair, much more dangerous. In fact, opioids are linked to an increased risk of falling, something that can be particularly concerning as we get older and our bones become more fragile. But it's not just opioids that pose a risk. Even over-the-counter pain relievers like ibuprofen, which are often seen as safer alternatives, can cause dizziness and affect your balance when taken in higher doses. If you're feeling lightheaded or unsteady after taking pain medications, it's crucial to talk to your doctor. They might adjust your dose or recommend other ways to manage your pain without putting you at risk for a fall. To minimize this risk, try to take the lowest effective dose possible. Stay hydrated and avoid mixing pain medications with alcohol or sleep aids, as these combinations can amplify side effects. If pain relief continues to interfere with your balance, discuss alternatives like physical therapy or non-drug treatments that might be a better fit for your lifestyle and health needs. 6. Anti-anxiety medications, a double-edged sword. Dealing with anxiety in our later years is a common experience, whether it's due to health concerns, isolation, or the general stress of aging. Anxiety can feel overwhelming. To help manage it, doctors frequently prescribe medications such as benzodiazepines, commonly known as Xanax, Valium, and Ativan. While these drugs can be incredibly helpful in calming the mind, they come with a significant downside, especially for older adults. The sedative effects of benzodiazepines can make you feel drowsy and relaxed, which might sound comforting when you're anxious, but these effects also impair your coordination. With decreased muscle control and slower reflexes, your risk of falling increases drastically. Studies have shown that older adults taking these medications are far more likely to experience falls and fractures compared to those who aren't on them. If you're currently taking an anti-anxiety medication, it's important to have an open conversation with your doctor. They can help determine if your dosage is too high or if there are alternative treatments that might work better for you, such as therapy or lifestyle changes. Staying active through gentle exercises like walking or yoga and practicing relaxation techniques such as deep breathing can also help reduce anxiety without the added risk of falls. 7. The silent culprit. Medications you might not know are putting you at risk. While painkillers and anti-anxiety drugs are the most obvious culprits, other medications can also quietly contribute to balance problems and increased risk of falls. These include common drugs like antihistamines, antibiotics, and even medications prescribed for conditions like Parkinson's disease. Often, these medications are prescribed without the full awareness of how they might impact your coordination. For example, antihistamines, commonly used for allergies, can make you feel drowsy and unsteady. Certain antibiotics might affect your balance as well, especially in combination with other medications. Parkinson's medications, although necessary to manage the disease, can sometimes lead to dizziness or unsteadiness as well. The important thing is to be aware of how you feel after starting any new medication. If you notice new symptoms like dizziness, blurred vision, or trouble walking, make sure to bring them up with your healthcare provider. Being proactive about your medications is key. Regularly review your medications with your doctor, especially if you've recently started a new one. Don't hesitate to ask about potential side effects, and make sure they know all the medications you're taking, including over-the-counter ones. By staying informed, you can minimize the risks to your balance and overall well-being. How to protect yourself: a guide for seniors facing balance issues. As we age, it's common for many of us to experience some changes in our balance and coordination. Sometimes, the medications we take to manage various health conditions can also affect our ability to stay steady on our feet. If you're finding that you're feeling dizzy more often, struggling with weakness, or having trouble walking, it's important to know that these changes don't have to control your life. There are practical steps you can take to stay safe and improve your balance. Let me walk you through some of the best ways to protect yourself. Start by talking to your doctor. One of the most important things you can do if you're noticing changes in your balance is to talk to your doctor. It might feel like a small thing to mention, but these symptoms are significant and deserve attention. Sometimes medications you're taking, whether it's for heart conditions, high blood pressure, or even diabetes, can cause dizziness, fatigue, or a sense of unsteadiness. These side effects may not always be immediately obvious, so it's crucial to have regular check-ins with your doctor. They can help you review your medications and see if any adjustments are necessary. Your doctor may even be able to find alternatives that won't interfere with your balance or create dangerous situations. It's always better to address these issues early before they lead to bigger problems. Stay hydrated. It's a simple solution. Did you know that dehydration can make dizziness worse? It's an easy thing to overlook, especially when you're focusing on other health concerns. But when you take medications like diuretics, common for managing high blood pressure or fluid retention, it can lead to dehydration more quickly. That's why it's so important to drink enough water throughout the day, even if you don't feel thirsty. Staying hydrated can help reduce that feeling of dizziness and keep your body functioning well, particularly when dealing with medications that can sometimes leave you feeling weak. Take your time when standing up. This may sound simple, but standing up too quickly can cause you to feel lightheaded or dizzy. As we get older, our blood pressure can drop when we rise too quickly, making it harder for our bodies to adjust. So, the next time you stand up from a chair, try to do it slowly. Give your body a moment to adjust to the change in position before moving fully to your feet. If you do feel dizzy, don't try to power through it. Sit back down and take a moment. The key is to be patient with yourself. Your body may need a bit more time than it used to, and that's okay. Exercise. Strengthen your balance. It might sound counterintuitive, but the more you move, the stronger your balance can become. Exercises that specifically focus on balance, like Tai Chi or simple yoga, can work wonders. These exercises help strengthen your muscles and improve your coordination, reducing your risk of falls. It's not about pushing yourself to the limit. It's about doing gentle movements that improve flexibility and stability. Tai Chi, for example, is a slow, flowing practice that focuses on balance and control. Many seniors find it incredibly helpful, not only for their physical health, but for their mental well-being as well. Yoga, too, can help improve strength, flexibility, and overall balance. Start with simple poses, and remember that it's not about being perfect, it's about progress. Your muscles and joints will thank you for the care you give them. Adjust your living space for safety. Another key element in protecting yourself is making sure your living space is as safe as possible. This doesn't mean you have to go out and remodel your entire home, but there are small changes you can make to reduce the risk of falls. Start by removing any clutter that could trip you up, things like loose rugs, electrical cords, or furniture that's in the way. These small obstacles can easily cause a stumble, especially if you're already dealing with balance issues. You might also want to install grab bars or handrails in areas where you need extra support, such as in the bathroom or along stairways. If you find it difficult to walk without assistance, a walker or cane can offer additional stability. These tools are there to help, and they don't mean that you've lost your independence. They mean that you're being proactive about your safety. You're not alone. Facing balance issues as we get older can feel overwhelming at times. But it's important to remember that these challenges are common, and with a few changes to your routine, your home, and your health management, you can regain confidence and stay safe. Take small steps, literally and figuratively, and always prioritize your well-being. Speak to your doctor, hydrate properly, move slowly, exercise regularly, and make your living space safer. These are not just recommendations. They are ways to ensure that you can continue to live life to the fullest without unnecessary fear of falling or injury. It's about taking control and giving yourself the tools you need to stay safe and strong, no matter how old you are. Don't wait for balance issues to take over. Take action today and protect yourself for tomorrow. Medications play a critical role in our health, but they can also come with hidden risks, especially for older adults. By being aware of the medications that might impair your balance and taking proactive steps to stay safe, you can reduce your risk of falls and enjoy life with greater confidence and independence. If this information was helpful to you, please share it with others who may benefit. Let's work together to stay safe and healthy as we age.